Okay, today I'm gonna insert angiotype in a patient. The first thing I'm gonna do is I'm gonna verify my order with the MAR. Then I'm gonna identify my patient by the last name and the date of birth. Jan Doe 1998. Since this is my correct patient, I'm gonna compare the patient identification with the prescription order that I have. Now I'm gonna wash my hand, put on some clean gloves, and I'm going to put my patient in a high flower position. If it's not contraindicated, I'm going to make my supplies ready. I need MSS basin, a cup filled with eye chips or a water, and a washcloth. I'm going to put this washcloth on the patient's chest so his dress doesn't get soiled. Now I'm gonna check the patency of the patient's nostril. I'm gonna ask the patient to close one of his nares and breathe to the other, and vice versa. Now I'm gonna measure the length of the tube that I need to insert inside his nares. The way to do that is I'm gonna measure from his nose to his earlobe to the process, and I'm gonna mark it with the tape. Okay, so now I'm gonna lubricate 3 to 4 inches of this tube. I'm gonna insert it from downward and backward from his right ear. And if the patient starts coughing, gasping, becomes cyanotic, is unable to speak or hum, then I need to discontinue the procedure and remove the tube right at that moment. So I'm gonna ask my patient to tilt his chin to the chest and ask him to swallow water while I'm inserting the tube. 1, 2, 3. I'm going to insert it up to the mark, and I'm going to secure it temporarily with the tape. Now I'm going to check the pH of the gastric content to make sure the placement is correct. Once the pH looks good, I'm going to send the patient to the chest x-ray for verification of the placement, and once the patient comes back and it's verified the placement is correct, I'm going to remove this temporary tape and secure it properly. Now I'm going to connect this tubing to the feeding pump or suctioning, or I'm just going to clamp it as the prescription has described. Now I'm going to remove my gloves, do hand hygiene, and I'm going to document the procedure, the type and the size of the tube that I used, the patient response, the description of the gastric content, and the verification that the placement of the tube was correct. Thank you.